you're having irregular periods, stop and listen to this. Having irregular periods is common. However, frequent or large changes to your menstrual cycle might indicate an underlying health condition. We know endometriosis, uterine fibroids, adenomyosis, and hormonal or non-hormonal contraceptives such as the copper coil can change your periods. Firstly, what is an irregular period? Well, as doctors, we consider a person to have an irregular period if the gap between the period is less than 21 days, or your periods are longer than 38 days, or if the length of each cycle varies for more than 10 days. It is more likely for your period to be irregular when you start your periods during puberty or when you're nearing perimenopause or menopause. Here are the top 5 causes of irregular periods that you might not know about, or they get easily overlooked. Number 1, pregnancy. Yes, pregnancy stops a person from having periods. A missed period or spotting instead of a period can be the earliest signs of early pregnancy. Other symptoms include morning sickness, nausea, sensitivity to smells, breast tingling or tenderness or fatigue, or your periods become irregular or stop. Number 2, stress. High stress levels are associated with an irregular period. Now, scientists confirmed this in 2021 by conducting a retrospective study on cycle irregularity during COVID-19 pandemic. Now, out of the 210 participants, 54% reported changes to their menstrual cycle in the early months of the pandemic. Those with higher self-reported stress were more likely to have longer, heavier periods. So we know when a person is stressed, the body releases stress hormones such as adrenaline and cortisols, and these can interact with the sex hormones that regulate our menstrual cycles. Number 3, being underweight. Excessive or rapid weight loss can cause periods to become less regular or even stop. This happens when parts of the brain stop releasing hormones that impact the menstrual cycle. The medical term for this is hypothalamic amenorrhea, and it leads to an estrogen deficiency. A person with underweight might develop dry skin or hair thinning, tiredness, difficulty concentrating, difficulty getting warm, and low mood. Number 4, excessive exercise. Now, in hand with weight changes, excessive exercise can also interfere with the hormones responsible for menstruation. Now, we see this in female athletes, dancers, and others who train intensively. If intense exercise is combined with a restrictive diet, a person might develop what's known as the female athlete triad, which includes disordered eating, menstrual changing, low bone density, or osteoporosis. This can result from pressure to be thin as well for those who participate in sports such as ballet or gymnastics. In some cases, there might actually be a competitive advantage to having a lower body weight. Some people find that stopping exercise is a real difficult thing for them to do. That's known as compulsive exercise. This also impacts their ability to control their weight, which also has a further impact on their cycles. Number 5, thyroid conditions. The thyroid is a butterfly-shaped gland in the neck that produces thyroid hormones. These have an influence on the menstrual cycle. Having an underactive thyroid is a condition called hypothyroidism, which means that the thyroid gland does not produce enough hormones. This can cause longer, heavier periods. Other symptoms include tiredness, sensitivity to cold, and weight gain. An overactive thyroid or hyperthyroidism can cause shorter, lighter periods. A person with this condition may also experience unexplained weight loss, anxiety, and heart palpitations. Now, irregular periods is a symptom, not a diagnosis. The best thing to do is to track your periods for 3 months. Book a routine appointment with your healthcare professional, preferably someone who does women's health, and make sure that we find the underlying cause of your irregular periods.